Good morning.
Good morning, Father.
Very good morning.
Hi, good morning, Father.
Very good morning. Very good morning. Good morning, good afternoon, good evening. Please type in if there are newcomers. Please type in where are you from. And you can type in the YouTube comment space any of your concerns. Today we'll be dealing with types of questions concerning reading part B and C on request. And those who are willing to interact. And if you can on your video, I am posting the YouTube Zoom classroom link in the YouTube comment space. You can join. If you're not able to be active, please attend via YouTube live, okay? Those who can be active, those who want to interact, can join special classroom. I have posted the link in the YouTube comment space. Thank you, Josina Joy, for the super chat. 3 chats, yes. 3 crowns. Yes. Hit the chat box. Any concerns? If you have any concerns, just type in the YouTube comment space. We'll include those things in today's sessions. Hit the chat box so that we reach the required chat rate to begin. Share to your contacts link. Yes.
Good morning, Father.
Very good morning.
Good morning, sir.
Very,
Good
very
morning,
good morning.
sir.
Very good morning. We're waiting for a couple of people to join. I'm just sharing the link. You can also do that. And hit the chat box.
Good morning, Father.
Good
Very
morning.
good morning, sir. Good
Very
morning,
good
sir.
morning.
Good morning, sir.
And those who come to Zoom classroom, please come with your name, okay? Instrument names, we will not be able to admit. Mute your additional instrument. Lower the voice of the additional instrument, please. And those who come to Zoom classroom, please come with your name, okay? Please mute the second instrument. Mute your additional instrument. Lower the voice of the additional instrument, please.
I don't know, background sound is very annoying.
Yeah, that's Anne or Sini Abraham, somebody. Do you have a second instrument? Please lower the sound. It must be Anne, I believe. Or Dr. Janaka.
I don't know, background sound is very annoying.
Yeah, that's Anne or Sini Abraham, somebody. Do you have a second instrument? Please lower the sound. It must be Anne, I believe. Please mute the sound of second instrument which you are using. Fine, thank you. Otherwise, that sound will be echoed again here to the participants. Yeah, everybody together hit the chat box. We have to reach at least chat rate 30 to begin with. Only Josina Joy is hitting it. So you can see that crown, 3 crowns throughout the message. That is Josina Joyce. Why don't everybody do that? The more you hit the chat box, you can get a crown as well. And I can easily make out that you are posting the things. The crown will attract the attention. You will have a preferential thing, attention. Yes. Hit and remind in the admins, please remind in the subgroups. And those who are here, just post your comments from Zoom classroom. At YouTube comment space, we are only 20, chat rate is only 23. We have to reach 30. Unless you together do it, it won't reach. Madhusri, Dorothy, Josina. See, if you scroll, you can see Josina's crown throughout, but others have not. Yeah, make sure you have one more instrument to connect to YouTube. Those are here. Yeah, and those who don't post any comments will be removed from the classroom because we understand you don't follow the instructions. Please hit at the comment space at YouTube comment space and type in where are you from if you're a beginner. So to begin in 2 minutes, that rate is still 23. Gurmeet Priya, you haven't hit the chat box.
Good morning, Father. I just did. Yes.
Yeah. Good morning. I can't access the chat box here at the Zoom classroom. Please connect me at YouTube comment space.
Yes, Father. Thank you.
Senior Brown is okay. But we have very small number. Yeah. Okay, let's have a minute silent prayer. Good morning, good afternoon, good evening, wherever you are from. Welcome to EduSkills, OET Medicine. Our mission is to make you fall in love with OET. If you're watching this on YouTube, kindly consider subscribing the channel, give us a thumbs up if you like our work, and share to your contacts so that we reach out to maximum number of OET aspirants, especially those who are financially struggling to crack OET. As per the request of OET aspirants, we are dealing with the types of questions today. Okay. And please share the link, YouTube link to your contacts so that we have sufficient number of participants benefiting from the session. Let me share my screen and let me know if you can see at YouTube comment space. Am I audible at YouTube?
Yes, sir, you are audible.
Yeah, at YouTube. I want a feedback from YouTube if I'm audible and visible. Type in yes if I'm audible and visible. You can't see the full screen at YouTube, right? Let me check if I can rectify it. Give me 1 minute. full session started. Link is already shared in the YouTube space. Please scroll down. Mhm. I'm just checking whether you can play full screen. The YouTube. Is the full screen visible at YouTube?
No, Father.
No.
No, Father.
No screen, Father.
No, Father.
Okay.
Screen is black. It's visible.
It
Types of
was
questions.
visible.
Types of questions.
Remains full screen visible?
Yes, Father, it's visible.
Yes, Father. Screen is visible.
Yes, sir, is now restored.
Okay. So types of questions. Basically, the success in OET is not just practicing. It's all smart work, I said. The basic thing is to understand the question. Understand the question.
Questions.
That's the basic idea. If you don't understand the question, it's going to be very challenging. However you practice, time management will be the challenge. If you are not able to manage the challenge, that shows the practice, the way you practice is not strategical or it's not proper. So we need to analyze. Maybe you have dealt with in the previous a couple of sessions in the previous batches and all, but then when you were asking, and somebody other day requested for model questions, explanation about model questions. So we include that as well in the questions. Model questions, actually, model verbs appear in opinion questions. And opinion and brief is the major aspect of reading part C. Okay. Now, basically, you must be able to read for context, main idea, purpose, opinion, and attitude of the speaker. Basically, reading part C bases itself on the opinion and attitude assessment of the speaker, the major questions. So also you should know the context and the main idea, that is gist, and the purpose. For which I said all these things will help you. Headings, subheadings will tell you what is the context. Okay, side headings or headings. Then synonyms, synonymous language, paraphrasing, I need not explain. Signal words, sequencing words, keywords, chronology or time expressions, suggestion, reason, scale, that is prioritizing, frequency, comparison, contrast, negative meaning. Okay. Basically, we are not bothered now. Ultimately, what I want to highlight is you will be reading for the context, to understand the context, to understand the main idea, understand the purpose of the text, understand the opinion of the author, and the attitude of the author. These are the 5 major categories. From these 5 categories, you have 14 questions, major 12 questions, but we will deal exhaustively with all the 14 questions. Okay, we will not be able to cover all the questions today, but then we will see our level best. Okay, focus on 14 question types. So the question, some doubts were raised, how to identify different types of questions. How many of you have the same question? Just type in me or type in yes in the YouTube comment space if you have the same question. Just I want to know where I have to focus today. Do you have a question called how to identify different types of questions, or do you know how to identify the type of questions? Me, yes. 1. Okay, 1, 2, 3, 4. Good morning. That's 5. Only 5? If there aren't sufficient people, we will deal with it later. Important. There are a couple of questions being asked in the YouTube comment space. So I have copied them. Okay. Second one, how does identifying the question type helps locating the answer? Why should you identify the question type at all? Let the question come, we will read and answer. No. It definitely, knowing the question type will definitely tell you where the answer is. Immediately, you can locate. Then third one, are these strategies applicable to all materials? No, only to authentic materials. Answer is no, only to authentic materials. And I tell you, 70% of the materials available to you at the social media are unauthentic materials. Practicing unauthentic materials will not only kill your competency, that also will exhaust you and make you hate OET. Fourth question is, what is the difference between strategies and tips? Strategies and tips. Tips is the new word coined by the health professionals for strategies. That's all. Strategies is the academic word. Tips is the colloquial word coined by health professionals, especially nurses. Okay, because they search continuously in the YouTube, OET tips, right? Are the strategies same for all the materials? Definitely. You can't get any other special strategy. Time management, how? There is nothing called time management in OET. Once you are competent, the time will be defeated automatically. Okay. So question types. I'll put it in order because I ignored animation. I could not complete. Okay. Name-based question you already know, right? If you want to the episodes, maybe more than 10 questions I have given examples, episodes. What is name-based question? Anybody? Please type in or shout out.
Immediately go to the name in the paragraph.
Okay. And beware of singular and plural. Sometimes they will say the question will be speaking about one person. Options will speak of plural. So that option can be immediately eliminated. So name-based question I'm not explaining now because I have explained it ample times, 1 to 39. Make sure you have completed 1 to 46 episodes are uploaded, but 1 to 39, make sure you have watched it and you have responded in the comment space. Otherwise, in the long run, you'll be out of the active batch as well as the discussion groups. You'll understand you have, sorry. So that's a basic requirement to be, and whenever you request to be a part of active batch of discussion groups, please mention whether you have completed 1 to 39. And we'll be having a screening. You should have put at least one comment in the comment space telling that you have completed. And this today or tomorrow, we'll be giving the Edu registration number only for the active serious learners. Okay, name-based question. So we are not explaining, you know it. There will be a name in the question stem. If there is no name in the question stem, name is not relevant at all. Having a name in the answer options or in the text is not relevant. Name-based question means there should be a name in the main line, question stem in the question, first line. Okay. Then opinion questions, that's what somebody was asking about modal verbs. So we'll be dealing with it. Focus on opinion and fact language. Then focus on modal verbs and look for opinions after the contrast word and in a complex sentence, mostly in the main clause. In the main clause. So, in the name-based question, if there is a name in the question stem, immediately you locate that name in the text and read only what is connected with that name. Nothing else is to be read. That is time management. Within fraction of seconds, you get the answer. Okay. Then opinion questions, you have to see the language, especially of the answer options. If an opinion is asked as the question, name also will help. When they say, I will come to details in that, name also will help because they'll be asking somebody's opinion. Then in the answer option, you have to distinguish between opinion and fact. Factual statements can never be the answer of opinion questions. So immediately you can eliminate all the factual questions. If you don't understand, let me know. In your response, we'll take specifically a session on opinion and fact language because opinion is a major aspect in reading part C. Then focus on modal verbs, which we will be explaining to you. Okay. For example, there is a must, modal verb must in the question stem. So in the text, you have to look for must or a synonym of must in the text, and you will have the answer there. Or you have should or may, perhaps in the question stem, may in the question stem, perhaps or possibly, or may in the text. We'll give you examples for that. And look for opinions after the contrast word. That's why we call it, if there is a contrast word, answer is after the contrast word when there is an opinion question. Make it very clear. When there is an opinion question, if there is a contrast word, answer will be after the contrast word. For other types of questions, don't consider after, it will be after the contrast word. But most of the time, answers are after the contrast word. But all the opinion questions, you will have the answer after the contrast word. What are the contrast words? Just type in the comment space if you know. Please type in the comment space. What are the contrast words? Fast. Yes, Jaxmini admin says follow one mentor. That's essential to enhance your competence. I didn't know how to identify type of questions. Okay. Okay. However, but, although, yes. Okay, but, although, though, however, although, but, though. Yes, those are the examples. Cool. Now, third type is gist-based question. Where do you focus? On the topic. But then it will be the summary. If you don't understand from the topic sentence, if you have competency, you just read the topic sentence, you will understand what is the gist. If you have a doubt, the whole paragraph, the summary or the essence of the paragraph will be the answer option, right answer option, where you can also identify repeated keywords. Detailed based question, focus on the developing sentence. That's why I said, yeah. That's why I'm telling you, if you have not completed episodes 1 to 39, you may not understand these things. Unless you know what is paragraph structure. Maybe 3 or 4 episodes I have explained paragraph structure. Unless you know paragraph structure, you will not understand what is topic sentence, what is supporting sentence, what is developing sentence. The only answer for everybody, if you have doubt regarding these things, watch those small videos. Episodes 1 to 39. Episodes 1 to 46 are published, but basic things are included in episodes 1 to 39, which is posted daily in the main platform, even in the batch groups, or you can ask for it in the main platform, main Telegram group. And basic is you should have a Telegram app downloaded, okay? because since we have thousands of learners, you can't manage with WhatsApp. Not only that, your privacy is secure in Telegram. So basically, to benefit from all the trainings and materials and programs of EduSkills, you need Telegram app. Okay. Then exception-based question. Focus on the last portion of the text. Okay. Next type. Anybody? What will be the next type? Eighth one.
Lexical.
Name-based question. Okay, sorry.
Lexical question.
Yeah, lexical questions are there. Then
Inference.
inference-based question. So opinion question, gist-based question, discipline, the exception-based question, inference question. Focus on reduction or focus on the last portion of the text. Two questions you have to focus on the last, which are the exception and inference.
Inference.
Mm.
Yeah, inference weights. At the end, in the conclusion, they will say their opinion. They will be explaining so many things. Then they say, therefore, this is this. Then lexical question, as somebody said, there are two types of lexical question. One is
Vocabulary,
Vocabulary.
and
vocabulary. Other one,
reference.
reference. Okay. Next one, contrast word-based question. Focus the portion after the contrast word. Ninth one, comparison-based question. Focus on advantages, disadvantages, similarities, dissimilarities. Okay. Then about questions. Beautiful. There are so many about questions. Where to focus? Focus on the keyword or the phrase or the concept in the question set. Asking about some device, about some person, about some diagnosis. The main concept word will be given in the question stem. So you have to focus on it. Purpose-based questions. The question will ask, what is the purpose of this email? Focus on the topic sentence or the gist. Then inference-based question. Focus on the conclusion. Cause-effect question. Focus on cause and effect. If there are two options speaking about effect, two options passing about cause, whichever speaks about cause, if the question is asking for reason or cause, other two can be immediately eliminated. Negative expression-based question. Focus on what is not given in the text. One of the options will not be given in the text at all. Here, in this 14th type, most of you make mistakes. In spite of all the teaching and learning, most of you choose the answer which is there in the text. In negative expression based, in the sense, what is not true according to this text. So, one option will not be given in the text. That is the right answer. Okay, let's take one example. Okay, sample. This is from sample 1, reading part B. So this is for both. If you have got the ebook, you have it on page 17 onwards. Okay. Let's type. Though it's familiar, we will be learning how to identify the question type and how to apply the strategies, and how does identifying question type helps locating the answer. So we are taking a familiar passage. The manual informs us that the blood pressure monitor. What are the heading words?
Father,
Fast.
Excuse me, sir.
Screen is not visible, Father.
Not visible.
YouTube.
Okay, sorry, let me check. I'll share one more time.
And now, okay, Father.
Good. Thank you.
Yes. The manual informs us that the blood pressure monitor. Fast at YouTube.
Manual
Zoom.
informs the blood
Manual.
Pressure monitor.
Okay. Manual.
Blood pressure monitor.
Blood pressure monitor.
This is the basic idea. Okay. Option A is likely to interfere with the operation of other medical equipments.
Interfere,
To
likely to
interfere.
interfere.
Here,
Other medical equipment.
other medical equipment.
Okay. Option B may not work correctly in close proximity to some other devices.
May not work
And not work correctly.
Some other.
Some other device.
devices.
C should be considered safe to use in all hospital environments.
Should be
Absolute.
considered.
All, it's an
All is
absolute.
an absolute.
All is an absolute. Okay, if you don't understand what is absolute, you have to type in the YouTube comment space. That's how we understand. There are people who are beginners, then we'll explain to you. Okay, when you don't understand something, immediately type in the YouTube comment space. And others who are at Zoom classroom, if you find somebody has typed in some concern, you can just announce here. Okay, sometimes if I miss the thing as I am looking into the slides. Okay, so what is the principle? If there is an absolute word,
We can
Eliminate.
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 eliminate that option. So now we have only
Two
two
options.
options.
Two options.
Okay. Instruction manual, digital automatic blood pressure monitor, electromagnetic compatibility is the side heading, subheading. I said context can be electromagnetic compatibility of which one?
Blood pressure monitor.
Yes, please read.
Monitor.
Yeah, somebody with energy, with a smile.
With the increased use of portable electronic devices, medical equipment may be susceptible to electromagnetic interference.
Okay, this is the topic sentence, right?
Topic sentence. Yes.
Do you have any idea?
With increased use.
They are susceptible to electromagnetic interference.
Electromagnetic interference.
Which device? There are two things here. With the use of
Medical
portable electronic devices, one group. Medical equipment, this is singular. This is singular. Other one is plural. Now, may be susceptible to electronic interference. May. This is somebody asked me about
Model.
model verb. So, how do you identify?
The answer should be there.
Huh?
You should be able to get the
Between
answer.
these two options, any idea which could be the? Maybe susceptible means?
May not.
May
Correct.
May not work.
May not work correctly.
Correctly, yeah.
Some other device, portable electronic devices.
May is here.
Mhm.
But then sometimes you can say, now you see, likely also sounds like may, right?
Yeah.
But then you have to differentiate between other medical equipment, operation of other medical equipment, and
The question
medical
is
device.
Other device. Some device.
Okay. Blood pressure monitor is likely to interfere with the operation of other medical equipment. Is the topic sentence speaking anything about other medical equipment?
Yeah.
Only one medical equipment, singular, right?
Yes, blood pressure monitor.
This speaks about, topic sentence speaks about electronic devices, portable electronic devices. They are not medical equipments.
Yeah, Father.
Okay.
Yes, Father.
Now, if first option is
Yes.
saying blood pressure monitor is likely to interfere with the other operation of other medical equipments like X-ray machines and other things. Okay. But here,
Yes.
second option is saying may not work correctly in close proximity to some other devices. Some other devices means portable electronic
Electronic
devices.
device.
Yes, yes.
Then that is explained here. Read, continue reading. Now, from the
This-
topic sentence, how you get a gist, then answer is clearly given again later in that passage. Okay, read.
This may result in incorrect operation of the medical device and create a potentially unsafe situation. In order to
Okay,
regulate
which will result?
the electromagnetic
Interference by
interference.
portable electronic devices, maybe
Devices.
cell phones, tabs, laptops. Okay. Okay. In order to
regulate the requirements of EMC with the aim of preventing unsafe product situation, the EN 6060112 standard defines the level of immunity to electromagnetic interference as well as maximum level of electromagnetic emissions for medical devices.
okay,
This medical device
confirms.
Okay. This medical device conforms to EN 60601122001 for both immunity and emissions. Nevertheless, care should be taken to avoid the use of the monitor within 7 meters of cell phones or other devices generating strong electrical or electromagnetic fields.
So care should be taken to
Should be
avoid
taken
the
to avoid
use of a
use of
monitor within 7 meters of cell phone. Within 7 meters of
Devices.
cell phone is the
close proximity.
Close
close
proximity.
proximity, right?
Yes, Father.
Yeah.
Close proximity within
7
Yeah,
meters,
cell
within
phone.
7
Cell
meters.
phones are the
Yes.
devices. Okay.
Mhm.
So you see in the top where as well as at the end, the same thing is paraphrased again. Now what they confuse, this type of questions are very common, okay? They are confusing two concepts. The manual informs us that the blood pressure monitor is likely to interfere with the operation of other medical equipment means they are not at all mentioning any other medical equipment, but only one medical equipment singular, that is blood pressure monitor.
Yes, Father.
Okay, blood
Yes,
pressure
Father.
monitor. No other medical equipment is mentioned. So they are not saying blood pressure monitor and X-ray machines will interfere. They are saying, explaining and saying at the end about cell phones and other devices, portable electronic devices. So may not correctly may not work correctly in close proximity. That is explained as within 7 meters.
Within 7 meters of cell.
Some other devices, cell phone and
Other devices.
Portable
devices. Yeah, some other devices means portable
electronic devices.
electronic devices or cell phone, which is again explained as cell phone or other device. So here, only two things are interfering. One is blood pressure monitor with the cell phones in your pocket, or your tabs in the pocket, or your laptops. Got it? So here may is a signaling modal verb to the answer. But sometimes there will be something like likely. If that is the case, concept will be different. You remember concept-based hedging words? This is
And
other medical
differentiate.
equipment is concept-based hedging word. Some other devices, concept. Okay? And hospital environments, concept. So what is our concept? Blood pressure monitor interfering with some other devices. Some other devices means portable electronic devices. Portable electronic devices means cell phones or other devices. These are known as synonymous expressions. Some other devices, topic sentence says as portable electronic
Portable
devices.
electronic devices.
And at the end it says, what is portable? What are the portable electronic devices? Cell phones or
Cell
other?
phones or other device.
How beautifully they have put. Okay, so may actually leads to the question. This may result in
Incorrect operation of
incorrect operation of.
medical
Right
device.
answer contains a modal verb and the incorrect operation. The concept repeatedly, both the sentences, first sentences includes may. Got it? That's why we say modal verbs can assist you in finding your answer. See now, some other devices, portable devices, blood pressure monitor, synonymous use this, medical
Medical
equipment,
equipment.
plural and singular. The medical device, again, the synonymous of blood pressure monitor. One synonym is medical equipment, other synonym is the medical device, synonymous expression. Then may not work correctly, may result in incorrect operation. May result in incorrect operation. Some other devices, portable electronic devices. How beautiful. So you should be able to identify these things, understand in this way. Okay, now check this one, the paragraph structure. The manual informs us that the blood pressure monitor, option B, may not work correctly in close proximity to some other devices. And that is repeated again at the end. May not work correctly in close proximity to some other devices. So first topic sentence and the concluding sentence both paraphrase the same option, B option, right option. Do you understand that?
Yes, Father.
Yes, Father.
Yeah. So
Yes,
that's the
Father.
beauty of paragraph.
Yes, Father.
So, let's look into one more question. Okay. What must all staff involved in the transfusion process do? Okay, there was some doubt recently. I told you if there is all in the question stem, what is to be done? You can't do anything. Okay. Okay. If there is all, you cannot eliminate question stem. Then you will be eliminating your result. So what must all staff involved in the transfusion process do? What are the hedging words?
Must.
What must all
Must
staff
is the modal verb. All staff
All staff. Transfusion process.
involved in the transfusion process.
What should they do? Option A, check that their existing training is still valid.
Training is still
Training
valid.
is valid.
Option B, attend a course to learn about new procedures.
Course to
No
learn about new
procedure.
procedure.
Yeah. C, read a document that explains changes in policy.
Changes in policy.
Okay. Okay, now, come on. With full energy.
Right patient, right assessment. The administration of blood can have significant
Sorry, someone. Hello, stop it. Okay. I think you have an internet issue, ma. It's getting disconnected. It's not clear. You can try after some time. Probably someone else can read. There is internet issue.
Right patient, right blood assessment. The administration of blood can have significant morbidity and mortality. Following the introduction of the right patient, right blood safety policy, all staff involved in the transfusion process must be competency assessed.
Okay.
To ensure the safe administration of blood components to the intended patient, All staff must be aware of their responsibilities in line with professional standards. Staff must ensure that if they take any part in the transfusion process, their competency assessment is updated every 3 years. All staffs are responsible for ensuring that they attend the mandatory training identified for their roles. Relevant training courses are clearly identified in Appendix 1 of the mandatory training matrix.
Okay. Any idea?
Staff
Ensure
must
It has
synonym of must.
Option C.
still option A.
Option C,
Option A.
option A.
Option
Ensure
A.
is the synonym of must, Father.
Changes in the policy.
Must.
Which one? Changes in the policy. Now, what must all staff involved in the transfusion process do? Staff must ensure that if they take any part in the transfusion process, their competency assessment is updated every 3 years.
Plan
Involved in the transfusion process is equivalent of take any part in the transfusion process. Correct?
Yes.
Yes.
Involved
the transfusion process.
is synonymous of
Involved in the process.
correct?
Yes, Father.
Yes.
Staff means all staff, right? In the first paragraph they have said staff means all staff must ensure. What must be done? Ensure, must. Their competency assessment is updated every 3 years.
It means still valid.
Yeah.
Training still valid.
Training
Still
still valid. How did you come to option C? Tell me. Let's see how it works. Read a document that explains changes in policy. Does it give any document? All staff are responsible for ensuring that they attend the mandatory training, identify their roles. What does it mean? Ensuring that they attend the mandatory training identified. Means they should be, their training should be always updated, valid. Relevant training courses are clearly identified in Appendix 1 of the mandatory training matrix. Anywhere it speaks about document changes in policy?
No.
No, you can explain, no problem.
Father,
Me, I think the answer. Okay.
Yeah.
Father, updated every 3 years means learn about new procedure.
No. Updated every 3 years means making sure that your training is valid. For example, OET must be updated every 2 years. Means making sure.
To me, Father, I check that their existing training is still valid by competency assessment, which they are updating every 3 years. I think this is a self-assessment tool that they are using.
Yeah, and changes in policy means they are not speaking about any policy here.
No.
Do they speak about any policy?
No.
About safety policy, Father. The second sentence.
But second sentence?
Yeah.
Where is it?
Third line.
Following the introduction of the right patient, right blood safety policy or staff involvement.
Yeah, the right patient, right blood is the title, right? Heading.
Yes.
That is speaking only about that policy. Does it speak about any other policy?
No.
Changing this policy?
No, Father.
Actually, C says, read a document that explains changes in policy. Means right patient, right blood is the policy. Now read some other document because there is a change in the policy. They are not speaking about any other changing policy, right? New policies.
No.
Okay. Attend a course to learn about new procedures. Do they say? All staff are responsible for ensuring that they attend the mandatory training identified for their roles. No, nothing
No
about
new
new
procedure.
procedures. Yeah,
No.
new procedure is not role, right?
Mm-hmm.
Not given.
So entirely different. Okay, but the clear signature is must and ensure other must,
Synonym.
double must. That's why I said modal verbs lead to the answer. Is the option, sometimes they will give you different options with the may. Okay, that will be must be competency assessed, must be aware of their responsibilities. Only must, everywhere must is used. The question term says must. Okay. Then nowhere it is mentioned that must attend a course, must read a document. Nowhere it is said. Is that clear?
Yes.
Yes.
Okay. Next question. What type of a question is this? What does this extract from the handbook tell us about analytic ducts?
About question.
About type
About
question.
about type question. So about what is the main heading word?
About analytic drugs.
Drugs.
Extract.
This is the main heading word. Extract, those things are like, I have not stressed this too much. Earlier I used to teach what is email, what is the structure of a notice, what is the structure of a extract, all those things. That's actually, people are not interested about 500 marks. Then I stopped. Okay. People are interested only 450. So if you need 500, you require all those things so that you defeat the time and get maximum. But people aren't interested in 500. Nobody tells me I would like to have 500 marks. So
500.
about, pardon?
500.
So you want 500?
Yes, Father.
Then we'll teach you later. Let me know in your response. Okay. Yes. About analytic drugs. Option A, they may be useful for patients who are not fully responsive.
Useful.
Patients
Maybe useful.
No.
may be useful. May be useful. Okay. Injections of these drugs will limit the need for physiotherapy.
Limit the need for physiotherapy.
Limit the need for
Care should be taken if they are used over an extended period.
used over an extended period.
Used on a, over an extended period. Okay. Now may, will, and should. This may here. Will here. Will means factual statement.
Factual statement.
Should means suggestion.
Suggestion.
Recommendation. Now come on with power.
Analeptic drugs, respiratory stimulants, have a limited place in the treatment of ventilatory failure in patients with chronic obstructive pulmonary disease. They are effective only when they are given by intravenous injection or infusion and have a short duration of action. Their use has largely been replaced by ventilatory support. However, occasionally when ventilatory support is contraindicated and in patients with hypercapnic respiratory failure who are becoming drowsy or comatose, respiratory stimulants in the short term may arouse patients sufficiently to cooperative and clear their secretions. Respiratory stimulants can also be harmful in respiratory failure since they stimulate non-respiratory as well as respiratory muscles. They should only be given under expert supervision in hospital and must be combined with active physiotherapy. At present, there is no oral respiratory stimulant available for long-term use in chronic respiratory failure.
Okay. Any idea? Now this is respiratory. This is the topic sentence, right?
Yes, Father.
Can you see the texture or taste of any of the options? Respiratory stimulants have a limited place in the treatment of ventilator failure in patients with chronic obstruction pulmonary disease. Limited place. Do you have any synonymous expression?
We limit.
Patients who are not fully responsive.
Maybe
Maybe useful.
Maybe
Maybe
useful.
useful. Limited place. See, this is opposite of, second option is opposite of. They should only be given on the expert supervision in hospital. They must be given. They only be given. Only be given combined with active physiotherapy. This is saying injection of these drugs will limit the need for physiotherapy. Means no need to have the physiotherapy. So text is saying that should be given together with the physiotherapy. But the second option says if you are giving these drugs, you need not have physiotherapy. Opposite, right?
Yes, Father.
Yes, Father.
It is opposite, yeah. Then care should be taken if they are used over an extended period. There is something about short period.
Yeah, for the short period.
Where is it?
Short time may arouse. The first paragraph, last line, Father.
Respiratory stimulants in the short time may arouse patients sufficiently. Last sentence.
Okay. Respiratory stimulants in the short term may arouse patients sufficiency to cooperate and clear their secretions. Care should be taken if they are used over an extended period. It's opposite. Speaking about short period, and the other one is
extend.
Short term. Extended period means opposite, right?
Yes.
Even if you don't understand other concepts, the text speaks about short term, whereas C option speaks about long term.
The last sentence, Father. At present, there is no oral respiratory stimulant available for long-term use in chronic respiratory.
Used over next, this is also opposite, right? There is no oral respiratory stimulant available for long-term use in chronic respiratory failure. Care should be taken if they are used over an extended period. Opposite, right?
Yes, sir.
Yeah. So only left is this. Now, where do they have explained? After, however, what is the thing? Occasionally, when ventilatory support, occasionally is contraindicated, and in patients with hyperactive respiratory failure who are becoming drowsy or out of the respiratory stimulants in the short term may arouse patients sufficiently to cooperate with the may arouse, may be useful, may be useful. For whom?
Becoming drowsy or comatose.
Yeah, patients sufficiently to cooperate and clear their secretions. Sufficiently cooperate means who are not fully responsive, fully cooperating. Patients who are not fully responsive. Not responsive means cooperate. Not fully cooperates. So it says it may arouse, may be useful for patients occasionally, sometimes, limited place, may arouse. Did you get it? Actually, limited place itself gives an idea, may be useful. May be useful, not always, sometimes. So what does it say? In general, above analytical drugs may be useful for patients who are not fully responsive. You see, their use has largely been replaced by ventilatory support. Now they are not using these drugs. Okay. However, there is a new thing coming. Occasionally, sometimes, This can help to arouse patients sufficiently to cooperate and clear their secretions. Patients who are not fully responsive. Got it?
Yes.
Yeah. However, the short-term respiratory stimulants. When dealing with patients following a safety incident, staff must avoid.
Must avoid.
Must avoid.
Avoid and
Must avoid. Okay. Option A, saying anything until the facts have been established. Yeah.
Yeah, from saying anything.
B, speculating on the possible causes of the speculating causes.
Speculating causes of incident. Causes.
Okay. And contradicting what has been said by other staff. Contradicting other staff.
Other staff.
Okay. Come on. Patient safety incidents. What should be avoided? Saying anything before things are clear, or speculating. Speculating means predicting on the possible causes of the incident. Other one is contradicting other staff. One staff says something and the other staff contradicts. Okay. Come on. Hello.
Patient safety incidents. Information about a patient safety incident must be given to patients and or their carers in a truthful and open manner by an appropriately nominated person. Patients want a step-by-step explanation of what happened and that considers their individual needs and is delivered openly. Communication must also be timely. Patients and or carers should be provided with information about what happened as soon as practicable. It is also essential that any information given is based solely on the facts known at the time. Healthcare staff should explain that new information may emerge as an incident investigation is undertaken, and patients and or their carers will be kept up to date with the progress of an investigation. The duty of conduct regulations require that information be given as soon as is reasonably practicable and be given in writing no later than 10 days after the incident was reported through the local systems.
Okay. Now, what they are asking is what must be avoided. Staff must avoid doing something, saying anything until the facts have been established, speculating on the possible causes of the incident, contradicting what has been said by other staff. Now, it's a topic sentence. What does it say? Information about a patient safety must be given to patients or their carers in a truthful and open manner. What does it say? What should be avoided? The other side of it.
Yeah.
Question says what should be avoided. Now this is saying what should be done.
So we should avoid speculating.
Yeah, we should avoid speculating.
Yes.
Yes.
Right?
Yes, Father.
See, you should say the truth. The topic sentence says you should say the fact, which means you must avoid speculating. Now, must, essential, they are the synonymous. It is also essential that any information given is based solely on the facts. The other side of it?
Speculating.
Don't speculate. Don't speculate. It's essential, it is must that any information given is based solely on the facts, means Please don't speculate.
Father, speculate means doubtful.
Predicting.
Predictive.
They will see your hand and speculate about your future marriage. Palmistry. Palmistry, you know palmistry? People see your hand, no? Hold your hand and see the lines there. What do? They speculate.
Okay.
Yes.
They speculate possible causes of the incident.
Okay, Father.
You don't know what happened, but then you will speculate why that girl was coming home at night. Okay?
Yeah. Okay, Father, understand.
Please don't speculate. Don't predict.
Don't predict.
Okay? Contradicting what has been said by other staff. Nothing is mentioned here. Two staff, nothing is mentioned. Okay? Staff quarreling. Option C says staff quarreling. One says this is the cause, other one says another cause. So that is not at all given, right?
Yes.
Yeah. And saying anything until the facts have been established. Must avoid saying anything. You can't speak anything. You have to plaster your mouth. Okay? When dealing with the patients following SFT, staff must avoid saying anything. You don't see anything here? What is this?
Absolute.
Anything is absolute, right? Anything.
Yes.
Absolute, right? You can't say anything. Zero, right? Do you have a right to say? 1%? No. 0% you have right to say. So in that case, if you understand absolute, that was eliminated in the first incident itself. And again, must essential, that any information given is based all on the facts. You must speak the truth. Means don't imagine, visualize, speculate, predict.
Okay.
Now these are the same language options being used in different questions. So you have to keep these options, understand these options. Okay? Whenever there is a negative expression, must avoid. This is called negative expression based question. What is not given in the text? Another negative expression based question. This says staff must avoid what? They are saying what must be done. Opposite must be avoided, right?
Yes.
Yes. Same type of style of language will be used. See, must essential. Any information given is based only on the facts known at the time. Speculating on the possible causes of the incident should be avoided.
Yes.
Okay. Now, opinion questions. We'll give you 1 minute time. Maybe if you want to have a super chat, you can have. We'll give you a super chat break. Okay, have some little snacks. At the same time, those who want to get a super chat, you can click on the link there, dollar icon below the comment space, just near the comment space. Starting from 10 rupees, you can get a super chat, which will show your crown along with your message. Samjana, thank you, Samjana. Yes, Samjana has got a super chat. Thank you. So that will give you a priority for your Anu Sabin. Thank you for the super chat. Yes. Easily we can make out now their messages with the Josina Joy, Anu Sabin, Samjana. Yes, thank you. That helps us to reach to more deserving people. See, if you scroll, you can see all those crowns. Even by chatting, hitting the chat box continuously, you can get number of, for example, you purchased 1, then without purchasing the other one, if you message frequently, you will get 2 crowns, 3 crowns continuously. Are you listening to me?
Yes, Father.
Yes, Father.
Yes, Father.
Yeah.
Yes, sir.
Take a break, small break, so that you have energy, or should we stop? What do you say?
No, Father.
No, Father.
Then hit all those who can get 1 super chat. That will be great support that you do to the platform, and also share the link hit the chat box. Only chat rate is now 13. If you bring it to 30, you will have at least 10 people more reaching the platform. So, yeah. Have some coffee or snacks. Okay. Don't punish yourself. See, as the chat rate is going high, the current viewers has come to from 20 to 30. Which means within seconds. Yeah. If I have not noticed your super chat, others can bring to my notice. Yes. Hello, Father. I have just started writing. Can you please share writing video for beginner? Thank you. Yes, it's being shared in the main Telegram group every day. Okay. It's shared in the main Telegram group every day. So you know if you are not in the main Telegram group, I am just posting the link here. Okay. Copy this. I'm posting the main Telegram group link. To benefit from all our resources, you should be a member of main platform, okay? Main Telegram group. See, I'm repeatedly posting the link in the YouTube comment space. Those who are not joined, you can join. Madhushree, thank you for the super chat. Yes, that's great. Adira Ranjit, thank you for the super chat. Yes, that's great support. See, small thing what we do, just 10 rupees can reach. You see, from 20 it has gone to 37. So 17 people reached when 2 people purchased super chat and hit the chat rate. Dorothy David, thank you. Yeah, thank you for the super chat. One super chat is equivalent to 100 chats, okay? One super chat is equal to 100 chats. Yes. Dorothy David, thank you. Thank you so much. What is coming next is going to be very, very important. Opinion questions, you know, that is a basic idea. Opinion and attitude of the author is the basic foundation of all the questions in reading part C, OET. Speculation means predicting. Yeah, these words, vocabs, you have to collect in your diary, okay? Diary of vocabulary. These are the basic words being used. Speculation. Prediction. When I explained about first method, if you have watched that video, you know. That's what I said. If you have not watched episode 1 to 39, in that one particular video, I have clearly mentioned what is speculating. First step of first method, foreseeing. Foreseeing means predicting or speculating. That's why I said 1 to 39 is very basic. You should write down notes and enjoy that. Then you will understand the rest of the things. Otherwise, in the long run, you will lose many things. That's why I have edited it and separately uploaded. Yeah, Sini Abraham, thank you for the super chat. Yes, great. Oh, I'm not able to read some. Madhushree, yes. Dorothy, there are Dorothy. Yes. Yes, let's go on. Are you ready? Say
Yes,
type in
Father.
yes. Type in
Yes,
yes.
Father.
The comment space. Patience is key to success. Abdullah, yes. Yes. Yes, Madhusri. Those who have some duty or other things, you need to ask my permission, okay? Anytime you can. Yeah. Let's go on to, let me share. Again, opinion questions. Okay. Yeah, it will be available in YouTube. Ready to go? Type yes.
Yes, Father.
Opinion questions, question type, and the focus. Name in the question term. In the opinion question, the first thing, if you have a name in the question term, you have to look for it. Question term, then go to the text immediately with the name about that opinion. Then modal verbs will tell you whether it is an opinion. Contrast words. Look for opinions after the contrast word. Complex sentence, where will be the opinion?
Independent clause.
Independent clause, main clause.
Yes.
It is in the independent clause or main clause. Marker words. Look for marker words which tells you here is the answer. Hedging words. Look for the hedging words, clearly signals bulb like a bulb, it is the answer. And emotions or subjective agreement. Surprisingly. Okay. Focus on opinion and fact language. These are the 8 things which will assist you to identify the opinion question answers, to locate the answers. We'll see what are the marker words, hedging words, other things we have seen. So identify opinion by marker words, hedging words, and emotions or subjective agreement. Okay, these are the new 3 aspects to be added to what we have seen. Marker words, what are the marker words? They might say, in my opinion, think,
say.
Think, Mr. Cloud thinks, say,
Suggest,
says, believe. These are the
advise,
common, yeah, I say advice, all those, yeah. These are the common words used in the text, okay? Or even in the question stem. Marker words clearly saying opinion. Then hedging words. What are the hedging words? Probably.
Probably, perhaps.
Perhaps.
perhaps,
Maybe.
Maybe,
Likely.
likely.
Yeah. Likely, maybe, perhaps, probably. All these are hedging words saying that is an opinion. The answer is there. And read for emotions or subjective agreement. For example, it's really compelling or interesting. Okay? Remarkable or worthy of attention. Unfortunately, sadly, worrisome. Such are the words that speak about subjective agreement or disagreement or about the emotions, opinion. So modal verb, can is ability, may is permission, should, advice or recommendation or suggestion, must is mandatory, necessity or obligation. You know them. Now let's look into this one. Oh, sorry. Yes. If it is seen in the YouTube. Yeah, thank you, Looks Real, for the super chat. Thank you. Thank you, Looks Real. Yes. Yes. Did it reach YouTube screen?
Yes, Father.
Okay. Now, question is, why can the human connectome help patients with schizophrenia?
Why, sorry?
Why? Else they are asking for a
Reason.
reason.
Human connectome.
Human connectome.
Human connectome.
Patients with schizophrenia. Okay, schizophrenia. Option A, because disorders like schizophrenia require unique treatment.
Require unique treatment.
Okay. Option B, because the disorder is distinctive for every patient, as is the connectome.
Distinctive.
Distinctive.
As is the connectome. So there is something distinctive. When you think of distinctive, disagreement, dissimilarity, similarity, what type of language is it? Bharat team, thank you for the super chat. Bharat team, thank you so much. Yes. What is that? When there is similarity, dissimilarity, what type of language is it? Comparison, exactly. So B option is doing a comparison. Okay. Yeah. C, because by understanding the connectome, doctors can understand schizophrenia. Because doctors can understand schizophrenia. Why can the human connectome help patients with schizophrenia? Because individual courses of treatments can be designed for every patient. Treatments
can be
designed for every patient. Come on, read. Let's see.
Yale researchers believe that by learning more about the human connectome, they might find novel treatments for psychiatric disorders. Things like schizophrenia vary widely from one patient to the next. By finding what is unique to a particular patient, a psychiatrist can tailor treatment to suit their needs. Understanding one's connectome could give insight into how the disease progresses and how the patient might respond to certain therapies or medication.
Why can the human connectome help patients with schizophrenia? Why can the human connectome help patients with schizophrenia? Because disorders like schizophrenia require unique treatment. It's distinctive for every patient, as is the connectome. Because by understanding the connectome, doctors can understand schizophrenia. Because individual course of treatments can be designed for every patient. So this one, what is this? What is this?
Can is the model verb.
Can model verb assist you somewhere? So do you have can in the text?
Could understanding one's connectome could give insight.
Could is past tense. Could is past tense. Do you have can somewhere?
Okay.
Could is past tense. Why can the human connectome?
Psychiatrists can tailor treatment to suit their needs.
Can tailor treatment to suit their needs. Tailor.
Designed for every patient treatment.
Tailor is designed.
Designed.
This one is same as this one, right? Designed for every patient. Tailor treatment to suit each patient's needs. Why can the human connectome help patients with schizophrenia? Because individual courses of treatments can be designed for every patient, can tailor treatment to suit their needs. Do you have can anywhere else in the paragraph?
No, Father.
No, Father.
That's why I said, when you have doubts, think if there is a model verb, try to connect that model verb. Then understanding one's connectome could give insight into how the disease progresses. Could is speaking about the prediction. Could is, this is not used as past tense here. Could you do that? Could you do that? Yes. Eugene Baru. Thank you for the super chat. Eugene Baru. Yes, thank you so much. And see, could is used as prediction. Understanding one's connectome could give insight into how the disease progresses. Could make us understand. If you plant trees, more trees, it could give you more shade when they grow up in the future. Okay? So, can is a clear indication to the answer. Did you understand that?
Yes,
Yes, Father.
Yes. See? Now, first one, because disorders like it require rhythmic treatment. No mention of treatment for schizophrenia. Okay? Second option, because the disorder is distinctive for every patient, as is the connectome. No comparison of connectome and schizophrenia in the text. Individual courses of treatment, tailored treatment to suit the needs. You want more clarity?
No.
See, can is here. Tailored treatment, individual course of treatments, suit their needs, designed for every patient. Believe, the researchers believe, is their opinion. Could and might says might respond to certain therapies or medication, and if and how the patient might. Speculation again. May, might. But can clearly tells you the answer is here. So sometimes try without, just look for the modal verbs and see whether you can identify the answer. Is that clear?
Yes, Father.
Yes, Father.
And you have to write down these paraphrasing this option, this questions and option, and this paraphrasing in the text. Then only you will understand. This is what we said. Look for opinions in the main clause. This is a
Yes.
complex sentence. Which is the main clause? Despite the countless challenges that the OET aspirants face in the low resource environment created by various service providers, OET remains the best hope for many health professionals in building up their future. Which is the main
OET
clause?
remains the
OET remains the best.
OET remains
Father's
Yeah.
screen.
Is it visible?
Yes,
yes,
Father.
Father.
Yes, Father.
Yeah. OET remains the best hope for many health professionals in building up their future is the main clause
Main.
or
Main clause.
independent clause.
And then clause.
How do you identify which is the main clause and which is the independent clause?
After comma.
Is
Yeah, normally if it starts with the dependent clause, it will be after comma.
After the comma.
Dependent clause, comma, then independent clause. This
Independent
is
clause.
essential in your writing, okay? You have to
Yes.
write in this way at least 1 or 2 complex sentences in your writing task, subtest. I have explained it with all the details over there. It's explaining about simple sentence, compound sentence, complex sentence, and all those things. So despite or the dependent clause will not have meaning itself. It starts with despite, although, such words. Okay. So where should you look for the opinions? Don't waste your time here.
Independent clause.
Till comma, don't waste your time. Just focus on independent
Independent
clause.
clause.
Okay. And look
Yes.
for opinions in the main clause. Although some patients, same thing. Although some patients might need
Patients might need-
stimulants to function well in daily life, the lumping together of many vague and subjective symptoms could be causing a national phenomenon of misdiagnosis and over prescription of stimulants. Now, is this sentence speaking in support of stimulants or objecting the stimulants given to patients? What is the opinion of the writer of this sentence? Does he support stimulants, prescribing stimulants, or he opposes prescribing stimulants? This is a complex sentence.
Pause.
Yeah. Is he supporting or opposing prescription of stimulants to patients?
Pausing,
Yeah.
Father.
Opposing, because in the first part, although some patients
Might need some
might need
stimulants.
stimulants to function well in daily life, although they need, please don't prescribe.
Yeah.
Okay? Although
Yes.
they need. Although you have to take some sleeping pills to get sleep in this hot weather, taking sleeping pills will create many other problems in your bodily cycle. So am I supporting sleeping pills or opposing sleeping pills?
Opposing.
Opposing. Yeah. Opinion is in its later part.
Yes.
Okay. Yeah. Look for opinions after the contrast word, if there is a contrast word. This finding certainly reveals the need for medical and behavioral services for these children, but it could also prove the non-specific nature of the symptoms of ADHD and can easily be mistaken for manifestations of ADHD. This finding certainly reveals the need for medical and behavioral services for these children with ADHD, but it could also prove the non-specific nature of the symptoms of ADHD. So the answer will be after the
contrast word.
Contrast word.
Yes. And best example is this we have seen. National Health Medical Council. You go swoop into the name here. Contrast word is there. So the opinion will be here. That's cool. We have seen it. So we are not going to look into it. Okay. Paraphrasing, we are not doing it. See, reservation, what reservation about the drug element is expressed in the 4th paragraph. But the reality is that it's not clear yet whether the changes seen from restored any lost memory. This reversal of damage may not have any effect on the patient's memory. See the other side about earlier you had positive given, right? Here also you have the same. Reversal of damage may not have any effect on the patient's memory. But the reality is that it is not clear yet whether the changes seen from LM11A31 restored any lost memory. Which means it did not reverse the damage of patient's memory. Don't worry, I'm not working out. Later on I will see. Okay. Look for names and abbreviations. Then you have immediately after that, you have the opinion. We have explained in the episode, several examples are given. So we are not going into it. Okay. See, this example also is given there. So you go to the name, right? Dr. Sota. Then before that, you need not, whatever is before the name, you need not read. All those things are explained. That's why I'm not going into it. Same thing with all these questions. Look for opinions after the contrast word. Yes. Let's see one more question. The extract from the guidelines states that option A, ICU staff can be seconded to other wards.
Seconded to the other wards.
B, only a consultant can refer a patient to the ICU.
Only
is an
absolute.
Only is an absolute.
Absolute.
So eliminate. The ICU is fully responsible for the patient in their care.
Fully
responsible.
ICU is fully responsible.
Patient in
the care.
Read now. Between these two, seconded ICU staff can be seconded to other wards. The ICU is fully responsible for a patient in their care. Read.
Unplanned admissions to the ICU need a referral at consultant level. In exceptional circumstances, referrals will be discussed with the ward registrar looking after the patient if a delay in referral to ICU would lead to a rapid deterioration of a patient. All patients discussed with the ICU staff but not admitted remain under the care of the primary team, and as such, they remain responsible for reviewing and escalating care should deterioration occur. We encourage collaborative patient-centered care. However, the ICU is defined as a closed unit. This means that when patients are admitted into the ICU, they are under the care of the ICU team. It is expected that members of the primary referring team will liaise daily with the ICU team to discuss the patient's management. However, it is up to the ICU team to make final decisions.
After the contrast word. So what happens as you skim through, you find a contrast word, whatever comes before that, you just ignore, right?
Yes.
Then focus on what is given after the contrast word and see which has a similarity.
And last sentence also,
Two contrast words,
it is
Father, however.
second contrast word.
If there are two contrast words,
After the second contrast,
it is up to the team,
ICU team to
ICU
make
team to
final
make final
decisions.
decisions.
Final decision. Fully responsible for the patient care.
Fully
Yeah.
Responsible for their care.
Yeah.
patient.
Option C.
You cannot say ICU staff can be seconded to other wards. This is saying ICU staff can be seconded, means can go to other wards.
Go to. Yeah.
No, Father.
But here they are speaking about, yeah. Cool. Just to tell you, you need not, once you glance through, skim through fast reading, when you find a contrast word, ignore what comes before the contrast word. So you concentrate on this area. Even here you have an answer, right? After the first contrast word also, remotely they are saying a closed unit means somebody else cannot interfere. They are under the care of the ICU team means ICU team is fully responsible. However, again, second contrast word, it is up to the ICU team to make final decisions about them. They are fully responsible. Correct?
Yes.
Yes.
Yes, Father.
Yeah, this one I'm not explaining. It will be too much for you. Hedging words are very, very important. Okay, concept. Maybe I will take one or two questions about questions to give you clarity. Okay. See about questions. What does this manual tell us about Shilpa's behavior? Okay. Nurses should be a model to others. Doctors should be available to the patients all the time. All is absolute.
All is an absolute.
Just giving an example, I created example. Okay. Now the question stem is, what does this manual tell us about Shilpa's behavior?
Shilpa's behavior.
Okay. Which means nurses cannot be Shilpa, right? Shilpa is singular, nurses is plural. Doctors is plural.
Yes.
Okay. Even if Dr. Shilpa is a doctor, doctors is plural. Not only that, all is an absolute. Even otherwise, concepts are different, right? Singular concept and plural concept. Shilpa, that is singular. Okay. Same type. You see here. What does this manual tell us about spacer devices? This is from the official sample. Thank you, OET, for allowing me to use this for teaching purpose. Do you understand? This is a real question. This is created by me. Just to give you an idea how simple it is. This is created by me. This is from official, I believe. What does this manual tell us about spacer device? First option, patient should try out a number of devices with their inhaler. Patients is the concept. Are we asked about the patients?
No, Father.
No. Third option says children should be given spaces which are smaller than those for adults. Concept is
Children.
Not spacer devices. Now they is a referent for
spacer devices.
They enable a patient to receive more of the prescribed medicine. Even if there is no text, you can choose the answer. That is the right answer. That's why I said we should be able to analyze the question. You should know the concept based hedging words. Okay. What does it speak about spacer devices? The question is not asking about what the manual say about patients or children.
Father, is this general versus particular?
Yeah, general versus particular, same. So plural versus singular is also similar as general versus particular. General means whole group. Particular means one group. See, singular, plural means one and many. General, particular means the whole humanity. Okay. And one particular group, Indians. Okay.
Okay, thank you, Father.
Our Asian continent is general. Indians, particular.
Yeah.
Okay. So that's the only difference. It's same. The criteria is same. Let's check if I can give you one. Here you see. Question. What daily activities of the child subjects in this clinical trial will be observed? What daily activities of the child subjects or child? Daily activities. Daily activities. Pre-eclampsia, is it a daily activity?
Oh, Father.
The concept is pre-eclampsia, no? If they had pre-eclampsia, they are eating, and option C, if they have siblings, this is called the concept-based hedging words. Is the siblings daily activity?
No,
Father.
Eating and
Exercise habits.
exercise habits. You have not seen the text. You have not seen the text. This is the text. There you have to find the answer. Screening for childhood obesity and vascular conditions. Let me just copy here if possible. One second. Duplicate. I'll make it smaller. See, such complicated text and such simple question. Okay. Now just try reading this text. Screening for childhood obesity and vascular conditions. Just read it. Let's see. You have identified the answer already, but just to cross check. Come on, are you exhausted?
No,
Father.
Brackets you can exclude. Okay, just go on reading. Brackets you can ignore. Hello.
The proposed study includes children aged between 9 to 10 years from the scope study. The scope study was conducted in Adelaide during 2005 to 2008 and 1164 nulliparous pregnant women, their partners and babies were recruited. Detailed information was collected during pregnancy. Of the 1164 women in the study, 861 had uncomplicated pregnancies, 93 developed preeclampsia, 118 had gestational hypertension, 95 normotensive women delivered SGA babies, and 69 delivered preterm. We will invite all children of women recruited to the SCOPE study to participate at age 9 to 10 years. Data will be collected on diet, physical activity. Height and weight hemodynamic measures will be done non-invasively as follows: central blood pressure and augmentation index will be measured using the BP plus cardiac output, and systemic vascular resistance will be measured using the SCOM 1A. Microvascular function will be assessed by post-occlusive reactive hyperemia method using laser Doppler. The results of children born after complicated pregnancies will be compared with those of children born after uncomplicated pregnancies.
Yeah, this is some idea about, this is not about siblings. They are giving general about children born before and after. See, what I'm saying, understanding, even you are reluctant to start reading, right? Such a big paragraph. And what is this? Of the 1,164 women, 93 developed preeclampsia. It is not, this day refers to women, right? Not children, child subjects. So what daily activities? You know, preeclampsia is not daily activity. Siblings are not daily activity. So even without reading, you can understand their eating and exercise habits are the synonymous of daily activities. So it is mentioned here that I will be collected on diet and physical activity. So what I'm saying, sometimes, not sometimes, maybe 30% you can go without even looking at the text, you can choose the answer. Do you understand what I'm saying?
Yes, Father.
Yes.
Yes, Father.
Good.
Yes, Father.
Yeah. Now, these are the synonyms of must, modal verb: ensure, ought to, have to, required to, necessary to, obliged to, essential, precondition, prerequisite, imperative, got to, obligation, mandatory, got to is repeated. So it's a repetition. All these mean must. All these words mean must. Any of these can be used. I think that is enough for it for today. No stamina? Why today's less stamina?
No, Father.
No, Father.
If anybody wants to come here at the YouTube Zoom classroom for a discussion, you can join. I'm posting the link again. Today's stamina was very less. Why is that? I'm posting the Zoom link. We'll be closing the live, and 5 minutes we will have discussion here. And we'll be starting the discussion today. And we have a screening group. That is not the actual discussion group. Okay, only active and serious learners who can manage timing and all those things will be selected to the real discussion group. Okay, this is a screening group. So depending on your response, at least you have to take 2 or 3 slots and discuss. Then you will be admitted to real discussion group. What time is it? What time is the discussion?
8:30.
8:30.
8:30.
8:30.
Yeah, IST. Indian time IST 8:30. Yes. And Zoom link will be posted prior to that. The classroom link of the discussion will be posted in the main platform. Try joining and support, discuss. That's the best way to improve your competence.
Okay, Father.
Yeah, anything else? One more time, hit the chat box. All of you, those who have not liked, if you like this session, please click the like button, okay? And you can see thousands watching the video, and likes are 15, 16, 20, 10,000 views are there. Okay. just click the like button. All those who are here at the YouTube live, did you hit the like button? And those who want to have a super chat, you can get it. Yes, try everybody so that you are familiar with that easy process of getting a super chat. You can click on that icon, dollar icon just near the comment space where you type the comment, and do it very easily. Okay, yeah, hitting the chat box, yes. By the meantime, if you have any doubts, you can ask here at the Zoom classroom. Anything you want to share, anything you want to ask. Father, thank you so much. Okay, you are welcome, Samjana. This was where mainly because Josina was asking for this model verbs. So I clubbed it with other things. Yes. An active people request, immediately we do that. Okay. Yeah, Ranjani, I was hectically busy preparing the thumbnail and posting and all that when you called me. You wanted a clarification on this session, right?
Yeah, Father.
Yeah. And how do you feel? Should you give that episodes as the session? I felt the majority, because we have been instructing them every time to watch them before doing anything. Hope a majority might have watched it, right? If they have watched and taken notes, we need not take it for discussions like last discussion. What do you suggest?
It's very good, Father. When we are watching, it is very important.
Yeah, should you take it for discussion like last time? It was taken for maybe 2-3 videos in a day's discussion.
Yes, we have done before.
Yeah, should we take it in this discussion or directly go to part A as I given the task today? Just I gave you a sample today.
Better the new basic things they should know, like a paragraph structure. The first 1 to 40 we can take. That's I hope that will be better.
Okay, then tomorrow onwards we'll have to post those things. Maybe 3 episodes one day.
Yes, Father.
Yes, Father.
Yeah, when it goes to paragraph structure and other thing. Yeah.
Paragraph structure they can understand.
Okay.
Father, in our daily sections, special batch groups are included. So all are know about the 1 to 39 episodes.
So you can just put in the YouTube here, YouTube. You can just post in the. Ranjani is asking, have you completed 1 to 39 episodes? Discussion at 8:30 p.m. on the OET Skills platform. Is discussion will be on Zoom classroom. Okay.
Yes.
Probably today we'll try to connect live so that everybody can find what is it, introduction. So I will also give you introduction today. Have the people taken, who is in charge today? Anybody, have the people have completed the slots, filled the slots?
Yeah, Father, slots are filled by first one, Madhusri. Second slot, Anu Sebin. Third one, Nidisha, like. Then last one, Josina Joy.
Okay. Slots are already filled, right?
Yeah, Father. But introduction topics are not filled, Father. Introduction topic.
Nobody wants to take? Introduction.
Today I have duty.
Father, Anita Thomas, Anita Taj, ma'am.
Okay.
Told if anyone can come forward, so madam will take the introduction part, reading part A.
All right. That's cool. If somebody is there, you can take up. Okay, Anita, they have actually gained a level of competency, so they don't require you need. We will assist you. Don't worry. There's nothing. They can take an introduction video. We can share all those things wherever you can ask for any assistance required. Admins will assist you. I think in the episodes there is introduction part here, right?
Yes.
Probably I have published one, Anita Thais, I think, introduction.
No further.
One discussion introduction was published there earlier, I believe. Video was published, no? I'll check.
Okay.
Probably I think one introduction video was published. Let me see. Introduction video. Give me 1 minute. Yes. Recent publications. This. No, that was not published, right? No. The previous discussion you had, right? Introduction, discussion.
Introduction we done ourselves.
Okay. I thought I published one. I don't see here. Not published, right?
No further. And the mom is already take a paragraph structure or like that.
Okay. Okay, then we can go even without introductions today, no problem. When we start after the episodes, we can go with introduction. If somebody is willing, okay, because they may not be familiar what is to be done.
Okay, sir.
Okay, then we will end the live stream. Bye-bye, everybody at YouTube. God bless you. You should come with more energy next time.